Today I'll be discussing about vasomotor rhinitis. The other synonyms for vasomotor rhinitis is intrinsic rhinitis. It is defined as a non-allergic rhinitis with clinically simulating nasal allergy with symptoms of nasal obstruction, rhinorrhea and sneezing. In these cases, one or the other symptom may predominate. Like some patients may have more nasal obstruction and less rhinorrhea. The condition usually persists throughout the year. There is no seasonal variation, and all tests of nasal allergy, that is, the IgE levels are normal. The skin prick test is negative in cases of vasomotor rhinitis. To understand the pathogenesis of vasomotor rhinitis, we should know a little bit about the anatomy of the nasal mucosa. Now, the nasal mucosa has a very rich blood supply. Its vasculature has sinusoids, which are surrounded by fibers of smooth muscle. These act as sphincters and they control the filling or emptying of these sinusoids. Now, when the sympathetic system is stimulated, causes vasoconstriction and shrinkage of mucosa, while on parasympathetic stimulation, there is vasodilatation and engorgement of mucosa, which leads to symptoms of excessive rhinorrhea, nasal obstruction. So, the main pathogenesis in vasomotor rhinitis is overactivity of the parasympathetic system, which causes these symptoms. Now, the autonomic nervous system is under the control of the hypothalamus, and therefore, any emotions or excessive grief, excessive excitement play a great role in vasomotor rhinitis. And in these cases, the autonomic nervous system is unstable. Many a time when you are very excited or you are very sad, there can be excessive nasal discharge, rhinorrhea, nasal obstruction, and this is all because of increase of parasympathetic stimulation. Even non-specific stimuli such as change in temperature, humidity, dust, smoke, all these cause the nasal mucosa becomes hyperactive and the response is in this form. Symptoms: paroxysmal sneezing. That means they may have bouts of sneezing which start early in the morning. Excessive rhinorrhea, and this has to be differentiated from CSF rhinorrhea. Nasal obstruction, and this alternates from side to side and it is more at night. It is in the dependent position of the nose. Postnasal drip can be seen. So when you examine the nasal cavity, you will see a very specific feature of vasomotor rhinitis is the turbinates will appear very congested and hypertrophic. And you can see there's a diagram which shows the congestion and hypertrophy of the middle and the inferior turbinate in comparison to the next picture, which shows normal nasal mucosa. So patients who have vasomotor rhinitis are prone to develop nasal polyp, hypertrophic rhinitis and sinusitis. So any patient which comes with these symptoms, a diagnostic nasal endoscopy has to be done, and from anterior to posterior nares it has to be visualized to see for any deviated nasal septum, polyps or signs of sinusitis. Now treatment can be further divided into medical and surgical line of treatment. Now, the medical line of treatment is the avoidance of physical factors which provoke symptoms. Like if the patient knows that on exposure to dust or smoke or this pungent odors, he gets these symptoms, he should try to avoid this exposure. Antihistaminics and oral decongestants, just as allergic rhinitis, that will relieve the nasal obstruction, sneezing, and rhinorrhea, which are the main features of vasomotor rhinitis. Topical steroids like beclomethasone, budesonide, or fluticasone can be used in spray or aerosol form and they help to control the symptoms. Systemic steroids can be given for a very short time, for a week, and then it can be reduced in tapering doses in cases which are very severe. And a psychological factors also should be looked into. As I mentioned earlier, since parasympathetic stimulation leads to these features, so we should try to find out whether any emotional aspect is related to this rhinitis. Now surgical. Now sometimes they may be very hypertrophied inferior turbinate or deviated nasal septum polyp. So these can be corrected and the nasal obstruction can be relieved by reducing the size of the nasal turbinates by either we can go for partial inferior turbinectomy or turbinoplasty. Then video neurectomy. that is sectioning of the parasympathetic secretomotor fibers to node. This is done in extreme cases for patients who do not respond to the medical line of management. Then video neurectomy is done. Thank you.